This is Alexander, co-founder of Care Thriving. Welcome to Syringe 101. So today we're going to look at a number of different oral syringes and get a basic vocabulary of how they work, so you can talk to your physician, your pharmacist, your insurance agent about syringe and oral feeding needs and medication needs. So oral syringes are different. So we've all seen the syringes on the medical TV shows, where they have a big needle or like an EpiPen used for allergies. So oral syringes are different in that they don't use a needle that break through the skin, but they are an oral syringe, but they also aren't used in the mouth. They're basically used for patients that are tube fed for administering medications, water flushes, and things like that. So if you have a patient or a little kiddo who's on a Gtube, you're probably very familiar with administering medications like these if they can't take them by mouth. Now, here's a picture of a basic syringe. This is one of our favorites. It's a brand by the name of Neomed, and it's an O-ring syringe. And you'll see on the right-hand side there'll be an orange cap. Basically, the little caps are used to cover the end of the slip tip or the tip adapter right next to it to stop medication from leaking out. And the caps can come in different colors, and the color coding can be helpful. So if you have a number of syringes on a tray, you can use a different color cap, like a blue one, for instance, to simulate or to designate a syringe that may be used for water flush, blue for water. So that can be something that's helpful. Then to the right, you'll see the barrel, which is the main part of the syringe, with the dosage scale. And the dosage scale are basically those little numbers that are marked off in milliliters that are used for measuring the dose of medication that's in the syringe. And at the end, there's a finger flange or barrel flange that helps you hold it. And then to the right of that, we have what's called the plunger that fits inside the barrel. And at the tip of the plunger, there'll be a rubber a bulb or a plunger seal or a stopper. And again, this one is an O-ring. It's an O-ring because it's a small rubber circle that is sandwiched between two pieces of plastic, kind of like an O-ring seal on a washer or a faucet or something like that. And then you have the main body which is the plunger, and then the other end you have the thumb rest or the plunger flange that you push down into. And so syringes come in a number of different varieties and sizes. So here's a picture of a different selection of syringes, and you'll see there's some you can source at Walgreens, and then we see the Neomed and the Extamed, and then Monojet. The Monojet, the one on the far right, the big one. Monojet is typically carried at a lot of pharmacies. Are a very inexpensive syringe. They work well when used what they're meant for, but they tend to be less expensive. So one of the things with syringes to note is you see some are clear and some are colored. So one thing to make note of is if you're requesting syringes from your infusion supply center or your pharmacist or whoever your DME designated medical equipment manufacturer is, some of them are opaque. They'll be colored, like you'll see the orange ones there. And the orange ones, if you're dealing with a lot of medications that are a clear liquid, like let's say Levacitram or Keppra, if you're doing that with your patient, I would probably steer away from the opaque or color syringes. So it makes it really difficult to see what liquid or what medication is inside the syringe because of the opaqueness. Did I say that right? Opaqueness, the color of it. My understanding is that the colored syringes are meant for some medications that may be photosensitive or sensitive to light, and that's why they tend to color it to keep out bright light. If you know something other, or if I'm incorrect in my information, please put it in the notes. We're all trying to learn all this stuff together. So surprisingly, you would think that pharmacists and doctors' offices and nurses, they would have all of this stuff down, but in our experience, surprisingly, a lot of the differences people just don't know, and the differences are important for you as a caregiver for your patient, for your child. that you have the best tools available, especially when you're administering medications, right? Because it takes the risk and the liability out of that. One of the things to note is that, yeah, if you have any, if you're visually impaired or have vision issues, you definitely want a syringe that makes it easy to see and easy to measure. So, as I said, if you're using two different medications, maybe you're using something like levetiracetam or Keppra, which is typically found as a clear water-like liquid. There may be another medication you're using that it has some sort of opaqueness or a color. And if you're using a colored syringe, it's going to be real difficult to tell those apart because you can't see through them. Another thing to take into consideration is the markings on the outside of the syringes. So here you see a number of different style of syringes. If you look at the blue one in the center, I believe that's a Baxter product, and it's a very good syringe, and it's an O-ring syringe. But we found that all of these syringes are typically single-use items that are made to be used one time and then disposed of. But in a home environment, let's say if you're doing 8 doses of medication a day and you're doing that 7 days a week and you're doing that 4 weeks out of the month, you're going to go through a tremendous amount of syringes, and you're probably never going to get enough to actually utilize them as a single-use product. So more than likely what's going to happen is you're going to get some amount of syringes from your DME, and you're going to have to wash those and reuse them. And we found, although the Baxters are easy to read and clear to see, the blue writing tends to rub off very easily, especially once it gets in water. The orange ones by Neomed tend to last quite a long time. They tend to hold up pretty well under washing, and they tend to be still easy to read compared to the opaque ones. That's something to consider. There's also a number of different sizes of syringes. So here's a list of the Neomeds. They go from 1 mil up to 60 mil, and some syringes will have slightly different sizing. I think Baxter, some manufacturers, they make a 5 mil instead of a 6 mil. But as a best practice, you always want to use the smallest syringe possible for the dose that you're using. So an example would be, if you're dosing 1/2 of a mil, you would use a 1 mil syringe. You wouldn't use a 12 mil syringe to dose a 1/2 of a mil. It's too large. You're not going to get an accurate measurement, or it's going to be much harder to get an accurate measurement. Another example would be, let's say you're dosing 4 milliliters of levetiracetam or Keppra. You would use a 6 mil syringe, right? So not only will you be using a number of syringes, you may have a number of different sizes of syringes, and that's very important. So back to one of the issues about longevity on the syringes. So one of the issues that we ran into is that typically the syringes will be sent out from a pharmacist, and they won't think about that you're doing multiple doses a day and multiple doses a week. So, they just assume that, you get a month worth of, let's say, Keppra, levetiracetam, or something like that, and they'll drop a couple token syringes, plunger syringes, in the bag for you and think you're good, right? Well, the syringes not only, differ in color, size, and opaquity, but the tip, as we mentioned earlier, are in different configurations. So you have the plunger tip, and then the O-ring, and then even a type of syringe that has no tip. It's just solid plastic. And we found that if you're using certain medications, like perhaps your patient, your little kiddo, or has a seizure condition, and you just happen to be using CBD, with CBD or cannabinoids, are typically in an oil-based solution. They'll be a little oily, like an olive oil, or preferably an organic coconut oil. But what happens is that oil coats the inside of the barrel of the syringe, and it becomes very sticky or tacky, and the plunger tips are just a nightmare to use with that type of medication. So what happens is, as you see, the plunger is just like a rubber cap that will get stuck on the inside of the barrel of the syringe, and it will just stick, and it'll become immobile, and it'll just come off, and then you have this this syringe with a certain dose of medication that's fallen apart, and it gets very hard to utilize. We found that the best syringes are really the O-ring syringes, and you'll find these are very commonly used in hospitals. But again, hospitals, as a single-use syringe, they don't worry about cleaning them. They use them once and they throw them away. And they do tend to be more expensive, but when you're trying to reuse them or re-sterilize and clean them and use them over and over, the O-rings work so much better. They just actually last, and they'll hold up, and we usually can make them last for about 30 days before some of the markings, before they start to wear off, and then we can even still utilize them even just for water flushes or things like that. So what I would really recommend doing is that if you are working with a lot of syringes and you are working with a lot of medications that you're giving via Gtube, is to request and ask for the O-ring syringes, preferably the Baxter or the Neomed, preferably the Neomed, because as I mentioned earlier, the writing lasts longer. But generally, any of the O-ring syringes will just work a lot better for any of the medications. Now, the no-tip syringe, they work okay. But if you're maybe if you're taking tablets and you're cutting tablets and putting them in a pill crusher and dissolving the little granules in water or some type of fluid, the no-tip may not work very well with that because it doesn't quite seal, and sometimes it will get jammed up inside with the granules, where again the O-rings just work so much better than that. So, and on a side note, there's going to be a couple different videos on this. This is just a very short video to familiarize yourself with the general terminology of the syringes and the types that are available. Again, the O-ring syringes tend to work best. Sometimes you'll have a little bit of a catch-22 where the pharmacists won't even understand what an O-ring syringe is, and the people at the feeding clinics won't know the difference. And of course, you'll ask for an O-ring syringe, and the pharmacy will say, oh, it's really a feeding issue because you're putting it through a Gtube, right? So contact your feeding supply people, right? And you'll contact the feeding supply people, and they said, well, you're not really putting food or water flushes, you're doing medication, so it's really a medication issue, right? So they'll try and pass the buck and go back and forth. So and when that's kind of happening, you really have to push back and advocate for yourself, because there's a number of instances that are very important here, right? So if you're getting the El Cheapo syringes and the markings are washing off, you can't dose correctly. So it's a safety issue and it's a liability issue, and you should use those terms that they'll well understand, and a quality of care issue, which is another catchphrase that's good to use. So those are very important to know, and as a caregiver, it's very important that you find the best tools possible to dose medication, to keep medication dosages consistent, to keep them accurate. And for the safety of your patient, it's very important. So thank you so much. We hope this has been helpful as a short, quick intro to oral syringes. And again, this has been part 1. And we hope you subscribe and catch part 2, where we'll discuss how our routine is for cleaning and keeping them as sterile as possible, making them last as long as possible, as well as dealing with some possible insurance issues or issues with your providers, and helping to get the best tools possible for your caregiving. All right, thank you so much, and hit subscribe, and we hope to see you again. Take care.